So what treatments are available? Well, let's start with subcision. Subcision is a surgical technique, and it uses a needle probe. And the probe is inserted into the skin down to the level where this thick scar is. And it can be very useful in treating a boxcar scar. So we insert this needle probe, and we use it to break up this thick bundle of collagen. And we probe and break that up, and then we lift up the depressed area of skin to try and get it more even with the normal surface of skin. Now, sometimes when we're doing that procedure, we also use fillers. Fillers are injections of material from the outside right into the skin. And the idea is that once we break up this thick bundle of collagen and now we loosened up the skin so we can raise it, if we fill that space with a filler, it can support that area so that it maintains its level with the normal skin, and as it heals, it can stay that way. So we often use those two treatments together. TCA is another treatment that can be useful. TCA stands for trichloroacetic acid, and it's an acid that we drop right into the base of this depressed scar. And it creates an injury there. And when that injury heals, sometimes it can fill back up and become more of a normal level with the normal skin. Now, if we already have damage from the initial acne breakout, why would we want to create more damage? Well, the idea is that if we can create controlled damage, controlled inflammation using the TCA technique, perhaps when it heals the second time, we can control it in a better way so that the healing is more even and more controlled. And so ultimately, it could give a better appearance to the skin surface. Dermabrasion. Dermabrasion is a surgical technique that can be very aggressive. It uses a rotor instrument, and it peels off the layer of skin on the top, and it can go deep enough to get where the scar has formed. So the idea is if we can peel off the surface deep enough where the scars are, then when the skin heals the second time, again, hopefully in a controlled manner, the healing will be much more cosmetically appealing, and we can do away with some of the telltale signs of these other individual scars. Lasers can work in the same way. They can be deep enough where they get down to where the scar forms, and they can laser off that level of skin. And again, when the skin heals, it can heal hopefully in a more controlled way so that the appearance is much better when it's all healed. Now, using these techniques, you have to be very careful, because the risk is that when the healing occurs, it doesn't heal in a very controlled and improved way. There's always a risk that it can heal abnormally again. So you always have to be very cautious with that procedure and use a practitioner very skilled in those techniques. Injection. Injection is a technique that we use almost exclusively for hypertrophic or keloid scars. We inject a form of cortisone right into the bump where it's full of this thick collagen. And the cortisone medicine can help to flatten down and prevent the formation of these thick bundles of collagen. So we can then flatten down that bump into a more normal pattern, even with a normal skin. Finally, punch excision. Punch excision is a technique that we use for ice pick scars. And we use an instrument that looks like a little cookie cutter. And we punch out this deep scar, this deep hole, and we get rid of it, and then the ends of the skin left over, we bring them together and we put stitches. So we close it off and there's no more hole there. Now, the good part is we get rid of this deep hole, but you have to also be cautious because we're putting in stitches and we're creating another scar, but the hope is that that scar that we create can be done in a very gentle way so that when it heals, it's not very noticeable. So these are techniques that we can use to treat scars that now we understand how the scars form in the first place. So one of the take-home messages is try to initiate an acne treatment program that's very effective as soon as possible to prevent the formation of scars. But if the scars do form, we do have various techniques that can address the different forms of scars.